Hi, I'm Matti-Jackson, CEO of Matti Consulting. Thank you for joining me today for this segment of a four-part series entitled A Critical Hour for Long-Term Care. Chances are that all of us have heard something in the headlines recently about skilled nursing facilities, assisted living, COVID-19 and long-term care, or maybe something to do with staffing shortages in long-term care. The purpose of these briefings is to provide some data to sort of wrap around those headlines and to give us all some additional information to consider as we make our opinions and decisions about long-term care. This presentation provides a review of Washington's direct care workforce with a special emphasis on long-term care. I've pulled together data and provided analysis using several state and federal sources. The takeaway for me from this review is that Washington State's long-term care workforce is already at a critical shortage today. Providers are struggling to hire and staff to the care needs of our elderly. But what's even more concerning is that we have a large population that's aging into care over the next few years, and this shortage is quickly moving from a stage of critical to a stage of crisis. I want to start out by talking about the direct care workforce as a whole in Washington State. We have about 150,000 direct care workers, which would be registered nurses, licensed practical nurses, certified nursing assistants, and personal care aides. About 55% of those are working somewhere in long-term care, and long-term care in this definition would be the broader version, including in-home care and social services provided by the Department of Social and Health Services. Today, we're zoning in on assisted living and skilled nursing facilities, which make up about 21% of the overall direct care workforce. What stands out most to me about that is over half of the CNAs in this state and over half of the LPNs in this state are working for skilled nursing facilities and assisted living. Next, I just want to take a quick look at some demographics of the nursing staff that are working in skilled nursing facilities and assisted living and how that compares to other settings. The first thing that stood out in my mind is the diversity. Over 40% of nurses working in assisted living and skilled nursing facilities are non-white, and this is twice as diverse as what we see in hospitals. Another factor is 88% of the nursing staff are female, and we are dealing with an aging female workforce. The average age of RNs and LPNs in skilled nursing facilities and assisted living is age 49. The average age of a certified nursing assistant is age 41. But I think what strikes me the most is the number of individuals that are age 55 and older. These workers are going to be retiring between now and 2031. And this is in the face of shortages we already have. We can expect to lose approximately 30% of our workforce to retirement over the next few years. And there's no telling how the COVID-19 pandemic or economic upturns or downturns will play into the people's decisions to retire, but this is clearly a policy item we need to take under consideration. When we're looking at increasing the pipeline and getting the supply chain opened up and getting more workers out there, one of the considerations we have to take into effect is the number of people that will be retiring out of this field over the next few years. This next slide I'm bringing to you because I've seen of late some articles and headlines that point out concerns with that we don't have sufficient staffing levels for direct care in our skilled nursing facilities. And so one of the things that I think is important to talk about is that in Washington State, we actually have fairly progressive staffing standards required by law for skilled nursing facilities. The law requires 3.4 hours per resident day. And what that means is nurse face-to-face time with a resident needs to be at least 3.4 hours per resident day. And it also requires that an RN be on staff and on campus and available for oversight and service 24 hours a day, 7 days a week. How this compares to federal law is that the federal requirement is sufficient numbers of staff based on the assessment of the resident on a 24-hour basis. In addition, the RN requirement on a federal level is at least 8 hours a day, 7 days a week. So again, Washington is more progressive than the federal code. It's also more progressive than most other states. One of the things that gets brought up is that in 2001, a study was provided to Congress that suggested that nursing facilities should have a minimum staffing standard of 4.1 hours a day of direct care. And in 2016, they did not incorporate that into their new revamped law. I think this is because one of the issues that many states like our own is facing is how do we meet our goals for quantity of staffing as well as quality of staffing amidst these staffing shortages that we're facing. And so this is a policy consideration that we need to take under our wings and start working through as we move forward with what we want our staffing to look like for skilled nursing facilities in our future. So while Washington law requires 3.4 hours of nursing time per resident per day, we actually exceed that in Washington state. Recent data shows us that our hours per resident day are 4.36, that we rank 9th in the nation for the highest levels of direct care staffing in skilled nursing facilities, and that we're 12% higher on the hours per resident day than the national average. In addition, CMS has what they call a 5-star quality rating. Each skilled nursing facility is ranked on the quality of its staffing. And in Washington state, 73% of our facilities rank above average. So in 5 stars, 3 stars is about average, 4 and 5 stars are above average, and anything below 3 stars is below average. And so what we see is we are 29% higher than facilities nationwide in our overall quality measurements for staffing. And we have most of our facilities above average when it comes to quality of staffing. There's only 6% that are actually falling below average for quality staffing in our state. So now that I've laid a little bit of a foundation about nursing staff in assisted living and skilled nursing facilities, it's time to delve into the shortages a bit. What we know from data is that on an average, at least between 2018 and 2020, the annual number of job openings is around 64,000 per year. On any given day, providers across the sector, whether that's medical, long-term care, anywhere in the healthcare or social services sector, are looking to fill about 35 to 40% of their nursing positions, which includes RNs, LPNs, CNA, and aides. What this map is showing us is where the hot spots are. So here is where we see the highest level, up to 40% of the jobs that are going unfilled. And over here in this lighter section, it's about 35%. But as a whole, our state is really suffering from the ability to get these jobs filled on a regular basis. And what happens in skilled nursing facilities and assisted living when they can't fill their employment positions is that they then have to turn around and contract with agencies to provide care because the residents need the staffing care regardless of whether or not they have enough employees to handle it or not. So one of the things that we need to think about when we're thinking about the pipeline and getting enough workers into the field to address our long-term populations that are aging into care is that assisted living and skilled nursing facilities are the largest employers of certified nursing assistants in our state. And this data is coming to us by way of Department of Health. And what we see is that we've been facing annual declines in this workforce in the number of individuals becoming certified and staying certified by about 2% per year. And this is accelerated over this past year. It's about double what it normally is. And this is mostly due to the pandemic. Training and testing were delayed and closed for periods of time due to COVID-19, and the state is now working on trying to get that backlog caught up. But this is a critical point for skilled nursing facilities and assisted living. We must find a way to get this a pipeline increased. This next slide is taking a look at population forecast data. And the reason for doing that is to sort of get a big picture of what's happening between the number of individuals that could potentially be working versus the number of individuals that will be aging into long-term care. And what we see is that from today into 2028, the number of individuals age 18 to 64, which is typically our working age population, will grow by only 3%. And the number of individuals that would be 75 and older, potentially needing long-term care, would grow by 60%. So we're seeing a pretty big change in the gap between these two population cohorts. So how are skilled nursing facilities and assisted living dealing with this staffing shortage and making sure that residents are getting the care that they need? Well, the answer to that is they're using contracted agency nurses to fill the gap. What we see in the data is that within skilled nursing facilities, Washington has exceeded the national average by 38% for nursing pool utilization over the past 3 years. On any given day in a skilled nursing facility in Washington state, there's approximately 500 contracted agency nurses working to help deal with the shortage. And one might say, well, what's wrong with that? Well, it's a concern on a couple of reasons. Using agency contracted staff as an operational norm may not be the most consistent or best practice way to provide care to a resident. What happens when you have an employee, they see the resident on a daily basis, they can see the little things that show that a resident's declining in needing more care or has a change in their demeanor or things. There's indicators that help them to know how to navigate that patient's care more carefully. When you have agencies, it's not untypical that you have different nurses on the floor facing the resident on a daily basis. Residents don't necessarily know the nurses. The nurses are not necessarily close enough to see declines in what the patient might need. So on an operational norm, it's not the ideal. The other part about this is Medicaid does not pay for it. So any resident that is a Medicaid insured resident that the agency staff is used to care for because we can't get the employees, Medicaid does not compensate the providers for that care. The next thing I wanted to talk about when we talk about staffing shortages is I want to talk about the revenue streams by setting. And the reason this is important because, you know, the types of revenue you have dictate the ability to pay adequately for your staffing. So just a real quick look at our healthcare coverage in Washington State via the National Health Expenditure data. 60% of our population's on health insurance via employer or private. Medicaid is 20%, Medicare is 14%. And what we see in skilled nursing facilities is there's a pretty heavy dependence on Medicaid insurance, and Medicaid rates are low. So it's difficult to compete for staff when you have lower revenue streams. Hospitals have a healthy mix that includes health insurance, as do physicians and clinics. Assisted living has a high reliance on private pay, but I want to note that the private pay in most assisted living is based on fixed incomes, not wealthy people. So the way that assisted living sort of compensates for low Medicaid would be to raise private pay rates, but you can only raise them as much as the market will allow. So if individuals are on Social Security and fixed incomes, they don't have a lot of high revenue streams coming in to compete for staffing either. So here's where the rubber hits the road with the payer mix information. We know that the settings that have more variety in their payer mix, in fact, don't rely heavily on Medicaid, have wages that are nearly twice as high as what we see in long-term care, skilled nursing facilities, and assisted living. The low Medicaid rates are hindering the ability for skilled nursing facilities and assisted living to actually compete and pay competitive wages. And this is a policy discussion that needs to be had in our state. And this, I'm throwing this in for good measure to help us to think about our pipeline to becoming part of our nursing workforce. This is a visual of the pathway currently to become a certified nursing aide. And we have a group that's working on trying to streamline this and improve it. But as you can see, it's very complicated, and it doesn't make it easy for individuals who would like to get into a career field and help us deal with our shortages that we are currently having for direct care staff. So our state currently has a steering committee that's working on trying to find ways to address workforce shortages, improve pipeline, come up with some forecasting measures to help us figure out how many staff we will need in the future for long-term care. And these are some of their recommendations. What they're suggesting is that first and foremost, COVID-19 has hit this workforce hard, that we have critical shortages already, and there's been a need to sort of waive some certifications with certified nursing assistants because of the closures and delays in testing and certification process. The state needs time to catch that up. And so that's the first recommendation, is to make sure that policy allows the state to get that caught up so that we can get those workers in the field, because if they don't meet certification within a certain timeline, then they're no longer allowed to be paid workers. So it's critical that we address that. In addition, streamlining curriculum, using online curriculum, using evaluations virtually versus in person, centralizing location for data and information that can then be used to project and forecast shortages, and then send that information out to the workforce development areas, as well as have a public dashboard available so the rest of us can know what's going on with shortages. And then last but not least, addressing low Medicaid rates. We cannot compete for staffing in long-term care without adequate Medicaid funding, because there's such a heavy reliance on Medicaid revenues to pay for staffing. If you have any questions or would like more information about the data or technical material in this presentation, please feel free to reach out to me. If you would like information about advocacy or the policy recommendations included in this presentation, please contact Washington Healthcare Association and/or Leading Age Washington. All of the resources that were used to build the data analysis in this presentation are available to you upon downloading this slide deck. Thank you.